Great, fantastic. So let's move on to kind of natural progression, really, OBGYN into pediatrics. We're really pleased to welcome Dr. Bilal Rahman to the conference, who's going to be talking all about pediatrics, application training, pros and cons, his journey. He's currently in the Northwest Deanery, an ST1 trainee, so he's been through these steps fairly recently, all the steps that you guys are all about to go through in the next year or so. So welcome to Dr. Bilal. And just while Dr. Bilal is doing that, there's an extra layer of gratitude because he's currently on call at the moment. And as you can see, there's a hospital environment behind him. And
Nice.
he's very kindly asked for a short slot for somebody to cover him. So we really, really appreciate the time and the effort for getting involved. And hopefully,
Just
all
one
you
minute.
pediatric budding pediatricians are going to benefit heavily from this.
So I'll start. So I am one of the pediatrics trainee, pediatrics ST1. So ST1 stands for Specialty Trainee 1. And I've recently joined, and this was my first position in the NHS, and I've recently started in the September. I'm from Pakistan. I completed my medical education in 2019. I completed my internship. I did 3 months of pediatrics there, then went into pediatric oncology for a year, then did 2 years of public health and community medicine, and then I applied for training here, and here I am. So I'll start with the presentation. I want to give a disclaimer that most of this information will be about ST1 applications because I was an ST1 applicant. There are some changes that you need to be aware of if you're applying for ST3 position. And if you want to ask, I know about some of them, but I may not know as well about ST3 applications as much I know about ST1. And all of the information that will be in this presentation has been taken from the RCPCH, Royal College of Pediatrics and Child Health. Their website is excellent. It's full of resources. It has everything that you may need help with when you're trying to apply for Pediatrics ST1. So do visit that website. It's a must. If you want to take one message from this whole presentation, that's this thing. Go to the website of RCPCH, write ST1 application. Everything will be there that you need. Okay, so let's start. So I'll be discussing a few things in this presentation. I've given you my introduction. I'll be talking about shape of training of pediatricians to be a specialist in the UK. Then I'll talk about must-dos for an ST1 application, then how the interviews goes, preferencing, and the takeaway messages. Let's start with the shape of training. So about pediatrics, most of the people who want to come into pediatrics have decided that after they have experienced working with children for a little while, because usually when I was a med student, I did not like pediatrics very much, but I did my internship because it is considered a very good rotation to do, and I enjoyed it thoroughly, and I enjoyed it in fact so much that I chose it to do it for the rest of my life. So there can be very different reasons why people come into pediatrics, but these are my three top reasons why I chose pediatrics. One reason is it is diverse, so it's a very good mix of, I want to say, a bit of balance between medicine and a lot of procedures, especially even simple procedures like doing an IV cannula or just any other procedures on a baby are very hands-on. You need a lot of skill and training to do them well. I love that part of it. And I get to interact with neonates who can't give you any history. They can't tell you a single thing about what is wrong with them, to teenagers who can lie about what they're feeling, not open up very easily. And it's a challenge to have a communication with them. It's playful. Children, they want to, as soon as they get well, they want to play with you. And to do a good examination on children, you have to play with them, otherwise they won't let you even come close to them and they'll start screaming. So playing with children is part of my job and I like it, and it's fulfilling. There is something that I feel that I'm making a difference in people's life. For example, if you're treating them for something which can have long-term implications on life, you are making a difference in their life that is going to stay with them for the rest of their life. And it's gives me a sense of fulfillment, like my job is important in the world and I'm doing something for the world to improve it a little bit. So if we talk about the shape of training, so we did talk about ST1 is a specialty trainee 1. So pediatrics training in the UK is a run-through training. That means you have to start it from ST1. There is no break in the middle and you have to continue till ST7. So quite recently, this training was 8 years long, but this year they have cut down 1 year. Now it's only 7 years long. So entry points are ST1 and ST3 now. So you can either enter at ST1 or ST3. Since last year, there was an option to join the training at the point of ST4, but now the RCPCH, they're no longer offering this, and it's only entry at ST1 or ST3. So the competition is published by Royal College of Pediatrics and Child Health. So for this year, ST1 application competition was 1:2.5-ish. So we can't have a half a person. So that means for all the people who will be applying, 1 out of 3 people will be getting matching into pediatrics or getting a training. But some people choose to go into other specialties. So this number may not be exactly correct. This is just the total number of applications and the applicants who are selected for training. Whereas at ST3 level the competition is way fierce. It's around 1:5. Okay. And for the first 2 years, you're working as an SHO. And after that, you transition to tier 2, which is the registrar level. And you keep working like that. And after that, you have an option to either choose general pediatrics. So you want to be a pediatrician, or you want to go into either subspecialties of pediatrics. These can include cardiology, endocrinology, pediatric dermatology, intensive care, neonatology. All of these, you can enter them at the level of ST5. And it's made in a way that 70% of the people will go to be as a general pediatrician. They can do a special interest, but they will be CCT'd in the pediatrics with special interest. Whereas if you go down the pathway of subspecialty training, you will get a CCT in pediatric cardiology or pediatric endocrinology. So you have an option to apply for that at ST5. Otherwise, you will go to the CCT pediatrics. Okay, I hope everything is clear about the shape of training, how long it is, and how do we flow about it. So we'll move ahead. So this screenshot has been taken from the website of Royal College of Pediatrics and Child Health. So this is about the timeline last year. They haven't updated it yet, so I will ask you to go online and see if they have updated it now. But when I took the screenshot, they didn't update it yet. So it just kind of gives you a timeline about how everything will go. So they published the vacancies on 2nd November, and applications opened on 3rd November, and applications closed on 1st December. So there is like a month's time for you to apply for this, and then shortlisting window completes with 13th January. Then interview invites. We'll talk about all of these steps in a little bit detail. This is just to give you an idea of where you can get this information in case you need it for this year. Okay. So now we'll move to the next section, which is must-dos for an ST1 application. So prerequisites. So if you are applying as someone who has not done a foundation program, which is the internship of doctors or house job for doctors in UK, you need to have a CREST form. A detailed guidance of who needs a CREST form is available on RCPCH website, and you can check it from there. But as a rule of thumb, if you haven't done a foundation year in the UK and you're not already in a specialty training program, you need to have a CREST form. So CREST form stands for Certificate of Readiness to Enter Specialty Training. I know that this year they have changed the form, so make sure in case you're getting it signed from your supervisor, wherever they are, make sure you are getting it signed on the latest version. They keep making changes into the competencies that you need to enter into training, so do be mindful of that. Okay. After the CREST form, there is a person specification document issued by RCPCH. You will find it on the same page of ST1 applications. And I've also added a link of this here, but I'm not sure if you will be able to access the link. Go through all of the person specifications and make sure you meet them, because if you do not meet the person specifications for an ST1, you will not be able to start your training. Then no previous pediatric or neonatal experience is required for ST1, but I will highly recommend that do experience a bit of pediatrics before coming into it. It's very different from adult medicine and other specialities, and it can be quite challenging at times as well. And this year they have introduced that there is a limit. If you have been working in pediatrics for more than 24 months after your internship, you should apply to ST3, and you cannot apply to ST1 now. Your point of entry will be at ST3 level. if you already have more than 24 months of experience in pediatrics after your internship. And advanced life support in pediatrics is not required. No extra scores for membership exams. If you plan to do them before starting your training, that's very good. But for your application, you will not be getting any extra scores. So this is the software called Oriel. So Oriel is the software on which you will be filling your application. It's a very different software and it's not very user friendly. So my first step about Oriel is like start early. It takes a little while to get used to the system and finding things where your application is, what you have to fill. So start early as soon as possible. Don't leave it for the last minute, and filling an application can take anywhere from 7 to 10 days. That's what it took me because I procrastinate and I'm not going to lie about it. So it may be similar for you, but if you think you can do it in one day, although I wouldn't ever recommend it, try to fill it as early as possible. And on last day, if you have passed the deadline, that means you cannot fill it afterwards, and you can run into any IT problems, especially if you're coming from Pakistan. There can be a lot of IT problems, so make sure that you do it well in time. And deadlines mean deadlines. That means you cannot fill the application after the time has passed. And if you see here, there is a little blue clock that's going on that software. It keeps running, and it's an indicator that you need to fill it before the time. And flow of your application. So once you have filled your application, the first step is long listing. So by long listing, they mean they're checking all the eligibilities. Your CREST form is complete and you have the required experience. You have done the internship that they need, or in case they need anything else that is mentioned on the person specification, they will be checking it against that. And once you're long listed, the next step will be shortlisting. How they will be doing the shortlisting is that will be covered a little bit later in in this presentation. Just give me a few minutes. After the shortlisting, there will be interview. If you have passed the interview, you will get into the preferencing phase, and then you will get an offer. So we've talked about long listing. We've talked about the criteria about person ST1 specification. So now we'll talk about shortlisting. So for shortlisting, you have white space questions. That means they are blank questions and you have to answer them like you will answer an SCEQ or like an LEQ. So these white space questions are about past achievements, clinical experience, career motivation, and transferable skills and governance. 400 to 500 words are required, a maximum limit for every question. So try to squeeze all the information that you want to put about something in those 400 to 500 words. And do focus on grammar and wording. No one on the other side would like to read bad English that doesn't make sense or it's not clear what you mean. Focus on quality over quantity. Don't try to put a lot of things. Try to explain them well and show the quality of them. For example, if you have done an audit, you just don't want to mention, okay, I have done one audit in my this rotation. You want to explain, give a bit more detail about when you undertook that audit, what was the thing, what guidelines did you compare it to, and if that audit was presented somewhere, that will get you extra marks. And if that audit led to a quality improvement project, that will get you more marks. That's what I mean when I talk about quality, because the person assessing on the other side cannot ask you a question back. So make sure you are covering all the aspects that are going in the mind of that person when you are mentioning something, either research or clinical experience. Do mention it in detail and try to cover the quality of it. How good was your experience? For example, if you're working as an internship in a hospital that's a tertiary care unit, it has a level 3 ICU, it has a level 3 neonatal unit, you would want to cover that. And limited space for information, you cannot cover everything, but you will have help about what things to cover, and I'll show you that in the next slide. Take help from person specification. So make sure that everything that is mentioned in the person specification is mentioned either in your white space questions or the application that you fill. And these white space questions are going to be assessed by 2 independent consultants, and every one of them, all whole these questions have 30 marks. So you will be scored out of 60. And last year, the cutoff was around 39. So if you compare it, that's quite a high score. So on these questions, you need to get at least 66% or more than that to score. And with every year, you may notice that the competition gets more and more. So try to get more than 66%, score a little bit higher. Shortlisting score, unable to meet this limit, means that you will not be invited to an interview. Now, these white space questions have weightage. The first question is about additional qualification. This means either a diploma, or if you have completed any masters or any research degrees, they can get you a diploma will get you 1 mark, whereas like a research degree like masters or qualification in pediatrics related to pediatrics can get you a score of 2. Transferable clinical skills. This means about your clinical like any procedures that you have done, or the basic principles about confidentiality and other things. You need to cover them here because these things are the same everywhere all over the world. Then you have to talk about clinical experience and reflection, or both of these have 4 score. So in this, you will want to talk about what you have learned so far. What clinical experience do you have? Excuse me. And reflect on it, how you can improve it, or what have you learned so far, what you want to improve further ahead. And then you come to your quality improvement projects or audits. So an audit carries as much mark, like out of 3, just as much as a clinical experience, as a good clinical experience, maximum 1 if you can get out of it. Then leadership and management relative to relevant to application level and experience of applicant. So during my undergraduate years, I was part of a lot of societies, and I was vice president of one, and I was running some other circles as well. That helped me score here. And while working in community medicine, I was organizing I was organizing a departmental teaching for students in there. So that helped me score marks in the leadership and management thing. You can have a thought about your career, what you have done related to leadership and management. In academic achievements, they want you to talk about your research, and it also carries 4 marks. If it is published in a journal and presented at an international conference, and you are either first or second author of one research, that can get you the maximum mark here. Then teaching relevant to application level and experience of applicants. So my second job after that included a lot of teaching related to community medicine and public health. And I was fortunate enough to collect feedback. So if you're doing some teaching, it is very important that you collect feedback, because they will want some evidence on that. And then statement to support application demonstrating suitability for a career in pediatrics. It's more like a personal statement, and this thing carries the maximum marks. Why do you want to go into pediatrics? All of this is available. There is some more detail about it available on the website of Royal College of Pediatrics and Child Health, so do visit that website. I cannot stress this enough. I know you must be tired of hearing this, but do go online, okay? Now, if you have scored well on your shortlisting, you will be given an invite for interview. So let's talk about the interview now. So you will be receiving a link about booking your interview. So interview happens around all over the UK, and teams from all of the deaneries. So UK is divided into small regions which manage your training. They are called deaneries. So every deanery arranges interview on their own. That means consultants from that deanery will be sitting on the panel, and they will be taking your interview. And you have an option to choose the deanery that you want to interview with. So you may not have a preference, but in case sometimes there are some accents that are a little bit harder for me to understand. That's why if you go online early, all of the slots will be available. Whereas if you will leave it for the last minute, you may be stuck with your only option, or you may be working on a day and may not have off on a day, because all of these deaneries are managing interviews on different days. And if you're busy on a day and cannot do it, or you want to do it on a weekend or when you're free, go online early so that you can have a slot of your choice. And then the site of interview does not affect your final placement. You will be scored out of the interview, and your interview score is the only thing that will count towards your final offer. Your shortlisting score has no implication. Once you're shortlisted, that score is not considered afterwards to decide your placement later on. Then in interview, it's 40 minutes long, and it has 4 stations. 4 stations that are 10 minutes long each. So the first station is about communication. It is a scenario based. You will be given a scenario in which there will be a role player sitting, talking to you, and you will be given the scenario 5 minutes before the interview starts, and you will have to talk to them and explain what you're doing, and they are assessing your communication skills. This station is not for your clinical skills, so try to find out early where the communication challenge is, because they can be very smart about it. They can be very open about the challenge, or they can hide the challenge somewhere inside the scenario, and you may have to go and uncover it. And if we talk about next scenario is career motivation. So this is about your portfolio and CV and the achievements that you have done before. So you don't need a written portfolio or CV, but I would want you to prepare answers for common questions like why you want to come to pediatrics, explain your previous clinical experience. So they have like very generic questions and they want you to answer them. So you have 10 minutes, and there are around 2 to 3 questions, or there can be a fourth one. So try to be able to complete your answer within 2 to 2.5 minutes, and don't surpass it. And make sure that you give as much detail as much you want to. And because if the 10 minutes are up, you will be interrupted. They have divided the time for every question. So if they're having 4 questions, that means after 2.5 minutes, you will be interrupted during the answer so that they can move on to the next one. Okay, and these questions can be about enthusiasm, suitability, and motivation for a career in pediatrics. Then the next station is reflective practice. So these 2 stations are judged by one team, and these 2 stations are judged by the other team. So reflective practice, they want you to reflect on something that went very well or something that went very bad. So if you are new to reflection, I would recommend go online and Google this term Gibbs reflective cycle. So Gibbs was a person who gave doctors a framework how to practice reflectively, how to think about what happens in our clinical practice and how can I improve on it. It's a very good resource and a very good technique in case you want to improve yourself and be better at what you do. So they want you to talk about something, an incident. It can be a good incident or a bad incident, but if you want to show uh, improvement, to try to choose the one where you learned something. So I chose one that wasn't very good, and you have to talk about it for around 7 to 10 minutes, because you'll have 10 minutes for it, and it just carries just equal marks as much as other sections. So do focus on reflection. And then pediatrics clinical reasoning question. This is like a short scenario where a child is sick and they want to see how you manage it, and they're not looking for very advanced skills in pediatrics. These are just based on F2 level. And if you have not worked in pediatrics before, they should be very easy for you to answer them, because if you know about medicine, they're fairly similar. And what they're focusing on is how you'll approach a scenario and not your final management. Don't jump into the treatment of things. Try to cover your first things. And uh, so people mention that always do A, B, C, D, E, but you don't have to if the patient is well. And my patient did not need an ABC assessment because he was fine. And you can run into common everyday scenarios. So do focus on what you're doing, why you're doing it. They can ask you about differentials. They can ask you about what you're going to do. And if at any time you feel out of your depth, do ask for senior help at any time, because it's considered very big in the UK. If you know when you need help, it's a very good skill, and you should know when you're out of your limit and you need someone else to come and have a look at the child. And 2 assessors for every station. They are consultants, and the total marks are 160. So you will get a score on this on the day that you will know about your placement. They don't publish them beforehand, and they don't rank you as well, but you do get a detailed feedback afterwards from the consultants, and they literally have put in the words that you have said exactly in the feedback. Was that sentence good? How the sentence could have been improved? So focus on your word in the lot. And minimum required to be deemed appointable is 88 out of 160. So you need to score more than half here. And if a consultant feels that there is a serious concern about how you have handled a situation, this can be escalated, because if you have although I've never heard that this has been done, but if they feel like you're being unsafe or there is a behavior that they have noticed that they cannot modify, you may be reported back to GMC from this interview. And low scores of 25 are also assessed in any station by either of assessors, and they will be looking at how the shortlisting happened if your scores were not appropriate for that station. I'm sorry about this scary stuff. I just wanted you to know beforehand. Top tips for ST1 interview: timekeeping. Plan your answers accordingly. Don't run over the time and don't fall short. Plan your answers appropriately. They shouldn't be too long and they shouldn't be too short. They should have just the appropriate amount of detail. I know it's easy for me to say this, but there is no way of knowing how much time you'll have for an answer on the day of interview. But uh, this is like, it's a very stressful time, and at that time things may get out of your hand very quickly, but I will want you to keep your nerves in check, and look professional, look your best, and have professional looking surrounding. I know my surrounding is not very professional looking at the moment, but just ignore it. That's the best I could manage at the moment. Practice with a friend, colleague, or family, or in front of a mirror. Anything that's available, practice, 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 because this interview is the thing that will decide that either are you in the 1 out of 3 person who will be getting an offer or no. So focus on it, give it enough time. It will pay you back later on. Prepare the question that you already know. For example, you know about the reflection question. That's the one that you can prepare in advance. And there are some generic questions about getting into pediatrics. Do prepare for them in advance. For communication scenario, you cannot prepare that. And the clinical scenarios, anything can show up, but it's fairly common. So if you prepare a few common scenarios, it's very likely that one of the scenarios from them will come up. Keep it simple and stick to basics. They don't want very hi-fi stuff or very advanced stuff, any advanced managements, or they don't want you to know final managements. Either you will admit the patient or you will discharge the patient. That kind of thing is not required. They want you to know basics. For example, the initial care that you can provide to a patient. So if you have been deemed appointable by an interview, that means you have scored more than 88, you will be given the chance to preference. So preference just means that within the regions of the UK, which region would you want to go to? People can have a lot of reasons why they want to go to any region of the UK. So I've listed the regions here. These are all of the ones that are available, and these are all the vacancies that they have. And what they will do is, once they have arranged you in the order of your scores, when your order will reach your first preference, if it is available, you will be appointed there. If that's not available, they'll choose your second or your third or your fourth or your fifth. So it only depends on your number, like score, how high did you score, will ensure that you match into your first preference. And here there can be some reasons. Apply as widely as you can to ensure success, because some regions, for example, uh, uh, not out of England, for example, Scotland and Northern Ireland, not some people are not willing to go to these regions because they are far away and harsh climates, and people don't have families there. So there can be many reasons. They are, if you will not preference them, you may not get selected to go there, and you cannot change your preferencing after the preferencing window has closed. And then don't rank a place where you would never want to go, because if you have ranked a place where you don't want to go later on, you deny that application, you will be out of the training cycle and you will have to apply next year. And consider subspecialty trainings offered. So every region has different trainings, subspecialty trainings that are offered. So if you know, or if you're interested in any of the subspecialty trainings, try to choose, make sure that the region that you're going to has that training. Consider the geography, because like UK has very variable temperatures and you can be into urban or rural settings. So if you have either preference, you can go into that. You can have family in any of these regions, or if you want to be close to nature, you can be in north. If you want a more diversity, more IMGs, you can choose one of the regions on the basis of that, or religious reasons. For example, I am from Pakistan and I'm a Muslim, and I wanted to be in a region where there are a lot of other Muslims and a lot of IMGs, and there are mosques and availability for me to practice my religion. That's why I preferred north of England, and I was very lucky to get my first preference. And then dietary requirements, halal food is easily available. If you have any dietary requirements, you can look them up and make your preference on the basis of that. And if you have to travel back to country, you should know where does your region have an airport. I know these things sound very petty, but there is no other way of preferencing, because UK training is standardized all over and there are no difference. So choice of region ultimately comes down to factors like this. And then if you have done all of that, congratulations, you will have an offer. So takeaway message from this presentation: keep check on the important dates, because if the date has passed, that means you cannot edit it later. Start completing all your application well before time. Don't leave it for the last minute. Be confident in the interview and stick to the basics. Don't rush to showcase your knowledge. Cover your basics first. They have more importance than going rushing ahead. Presence of your own Preference of your own liking and feasibility. Consider the factors that you want. And this is the code that I have taken from RCPCH, and I put it on my study desk when I was applying for these application. No one will say it will be easy, but it will be worth it later on. So this is a video done by RCPCH. It is on YouTube. You can go online and find it. It's a recruitment level 1 webinar and Q&A. It's very good, and it covers a lot of things that I have covered in the presentation today. In case you need to get in touch with me later on, this is my email. Take a screenshot of it. And if you have any questions about pediatric application, you are very welcome to put them in the chat box now, or you can email me and I'll be able to respond them in 5 to 7 days, hopefully. And thank you so much. It was very great to talk to you all. And now I'm open for any questions if you have them.
Wow, fantastic. Thank you so much, Bilal. So much information jam-packed into that short presentation. I think there's literally everything that has ever come to us in terms of a question. I think you've covered in that presentation. So credit to you, firstly. I think the way you got through all of that in a short period of time was great, yet you were still clear, to the point, succinct. And I think it was a really, really good presentation. So thank you.
Okay.
Let's just look at a couple of questions then, and a couple have come to me directly. So can you ask Dr. Bilal, I think you covered this a little bit, but can you ask Dr. Bilal why you finalized on pediatrics, and was it a last minute decision?
No, it wasn't a last minute decision for me. So when I did my internship, the last 3 months were in pediatrics. And after that, I applied for a pediatrics job knowingly the pressures of pediatrics, because everyone says that pediatrics is busy. And that's the same. But I loved working in pediatrics, especially how the teamwork that you will see in pediatrics. You don't I'll only say it because I'm very biased towards pediatrics. I love it to the core of my heart, but the teamwork that you will find in pediatrics, you are very rare. It's very rare that you will find it in other specialities. And working with children, it's full of joy on its own, especially seeing them improve. Children do get better very quickly, and they don't have very complex illnesses usually. That does not mean that you won't find children who have like 4 to 5 things wrong with them, and you may not be able to help them most of the times. But in like 70 to 80% of the cases, your job is just to reassure parents and focus on your communication and provide minimal management and minimal intervention. And that just means, I'll just give one example. For example, today my day included doing NIPs, and NIPs are neonatal initial checks, and I get to examine them, and I get to count their fingers and toes, which somehow gives me serotonin, and it makes me feel good about myself. And working with children on like children's ward, you will see the impact of what you're doing very quickly. And you will, on when you're going to bed at night, you will know that you have made a difference in the world, because a lot of illnesses of in children have long lasting implications. For example, a simple infection can kill a neonate, and if you were there and you were able to manage them, you have made a difference in their life. And this is what drives me to do pediatrics. And they say if you do what you love, you don't have to work a single day in your life. But I have to work. Some days are really bad, but some days are really good. So I think you
Yeah.
can't have all good all times.
Well, you can certainly see the energy. You can certainly see your love for the sphere, which is fantastic. The questions come in and say, are there any negatives of pediatrics that you didn't expect that you have found since you started?
So up until now, I wouldn't say it is negative, because all good things are difficult, and working into pediatrics can have a lot of challenges, especially if you're working in pediatrics, because you need to have very good communication, and parents are very anxious, and children, they don't give you a lot of margin. And on when I talk about history, you don't get a lot of history from your patients, so it is very challenging to work in pediatrics. But I knew all of it when I applied for this application, so I wouldn't say that I've had any negatives. Maybe I'm working. This is my first placement in the UK, and that's why I feel like this. I hope there are no challenges ahead, but I feel very well settled, and I feel that I can do my job efficiently and help my team achieve what they're doing.
Fantastic. You look as happy as in the photo over here. You're on call. You look the same, which is great. And then I think one final question just to tie that up. You mentioned it's your first pediatrics placement in the UK. The question is, did you do any pediatrics back home, and have you noticed any major differences?
Yes, so I have done 1 year and 3 months of pediatrics back home, but my experience was fairly limited to pediatric oncology. The 1 year, my internship included working in a level 3 pediatric ICU and level 3 neonatal unit. So I had a lot of experience, a bit of experience about general pediatrics and neonatology, but majority of my experience was related to pediatric oncology, where I was working with children who have cancer. And management of things is very different in them, because you are actually inducing majority of the illness by giving them either chemotherapy, radiotherapy, or the management of cancer is the thing that is causing majority of the symptoms. So when I came to the UK, the thing that was different was over here, nurses job have improved a lot, and they're able to help doctors very much, and they okay, they are able to help you achieve a lot of the patient care, and I love that, because back home nurses were trained and they had a lot of experience from us, but they had way more experience than us junior doctors, but we were not utilizing, tapping into their potential. So that was one thing that is different. And in UK, children are safeguarded a lot. That means that we want every child to have an equal opportunity to grow up to be a strong and happy individual and achieve what they want to achieve in their life. That means if they are in an environment that is damaging to them, or is somehow stopping them from developing or being the best version of themselves, we have to take action. This thing was fairly new to me, and I'm still learning how to do it, how to pick up on it, and then raise the alarms. That is new for me. Working with neonates, I had limited experience with neonates because it was only 3 months. So working with neonates is still very new to me, and I'm trying to find my way around it. So yeah, there are a
Brilliant.
lot of things that are new to me.
Yeah. And let's just finish with this final question then. It's the kind of question that we get for all specialties, really. But can a work-life balance be achieved with pediatrics?
So one of the reasons why I wanted to come to UK for my post graduation was the option to have work life balance. So, as an ING trainee, you can go as down to, I think, 50% and maybe even lower. If you have some commitments, why you cannot work 100%, you can work 80%. We call it LTFT, less than full time. And the NHS and HEE, Health Education England, they're trying to improve it as much as they can, because they understand that not all the people have may have some people may have commitments at home, why they can't work all time. So at any time, if you feel out of depth and you feel that you cannot cope up with work, you do not have to give them a reason. You just have to apply, I think, 3 months or 4 months in advance for them to plan an alternative, so that they can arrange for someone else to work the time that you don't want to. So you always have that option for that. And if you want to keep working full time, because LTFT comes with a pay cut as well. If you're working 80%, that means you will be paid 80%. So if you want to ask about work life balance, other than that, you will be only working 48 hours a week as a junior doctor. And if you're working as a consultant, a pediatrician, you have to be on site on most locations by till 10 o'clock in the night. And after that, if the ward is stable and you're not needed, you can be off site, but you have to live around the hospital and can be called at any time to come back to the hospital in case there is something going on. And for if you choose the subspecialty of neonatologist, I have heard that neonatal consultants have to be on site 24 hours, because neonates, they don't give you a lot of warning before crashing, and you may have to be there. You being there or not being there can be the difference between life and death of that neonate. So do consider all of the factors before coming to pediatrics. It's not easy, but it's worth it.
Yeah, fantastic. And like I said, you can see your passion straight through, and I think that's been picked up by people in the chat as well. So Bilal, thank you so much. It's not easy to do the last talk of the day and still keep people interested. So I think you did really well. What time do you finish your
Okay, yeah.
shift?
I finish at 5 o'clock today.
Okay, fantastic. Great. Well, I hope it all goes smoothly. And thank you so much for coming on board. And I think it was a super talk. Thank you.